low magnification, a really flat down angle like this, and it forced me to start doing dentistry like this. The second you drop your chin towards your chest, you're putting massive compression on C5 and C6. Trust me, when you're in your second decade of dentistry, you're not bulletproof anymore. That's where the aches and pains come. Until the best day of my ergonomic life happened. I learned about refractive loupes from Bryant Dental. Let me tell you about my ergonomics journey. So I started dental school at age 23. I finished at age 27. I didn't get my first pair of loupes until age 30. Okay, so I have 7 years under my belt at this time. And here's the cool thing. When you're that young, you're bulletproof. You can be a contortionist looking at number 15 like this. It doesn't matter. You can put your leg over your head. You're gonna be fine. You're bulletproof. Then I got my first set of loupes because your vision starts to change. I'm like, oh, wow, I can see things better. But here's the thing is they put you with a low magnification and a really flat angle on it. So then what happens is that was the beginning of the end. My first set of loupes is what fucked everything up. Low magnification, a really flat down angle like this, and it forced me to start doing dentistry like this. This was actually worse than what my original angle was because I could kind of cheat it and sort of look and tilt my eyes down. But with the flat angle, you can't tilt your eyes down. So for the next 10 years after that, I had to tilt my head down like this. Well, think about this from an ergonomic perspective. The second you drop your chin towards your chest, you're putting massive compression on C5 and C6. Trust me, when you're in your second decade of dentistry, you're not bulletproof anymore. That's where the aches and pains come. And it all started with getting sore neck muscles, and you go at the end of the day, kind of like this, you're good. But now all of a sudden the soreness starts turning into pain. And you start getting pain in your neck, pain throughout the neck muscles, and then pretty soon you have arm pain, shoulder pain. But once you enter your second decade, you can't get away with it anymore. And the compression and from your head tilting down in bad posture, the pain becomes more consistent and more constant. So then what did I do is I switched to microscopes. And I was like, hey, this will be fantastic because I'm gonna have to be like a submarine captain doing dentistry now, looking like this. And what I would say is that if you're an endodontist or you're just doing single tooth dentistry, it is a really good solution because it forces you to be upright. But the kind of dentistry that I'm doing, which is multi-unit dentistry, I'm doing a lot of restorative and aesthetic dentistry, you gotta see an entire arch in order for the case to make sense.
My life.
And the amount of time I was spending moving the scope and trying to move the patient's head and then get the thing back in focus, it was slowing me down big time. So then I went back to my loupes.
Kidding me?
And guess what happened with that?
There's no way to get a pair
coming back again.
So what did I do?
Until
I hopped a plane and went to London.
The best day of my ergonomic life happened.
To me, it was a no-brainer.
I learned about
my health is on the line.
loupes from Bryant
This
Dental.
is a one-way street.
And it changed
If you
my
practice
life.
dentistry
Now,
long enough,
there's a
you
story
saw what your
behind
dental
this.
instructors looked like.
As
They
soon as
all
I
looked
saw
like
about these loupes, I'm like, I gotta
Hunchback.
get a pair.
Every last
And I
one of
reached
them.
out to you
Hunched
guys,
over
and
like
you're only
this,
in London.
complaining
And I
about
was
their
like,
back
are you
and neck.
kidding me?
And to me, that's a
like there's no way to get a
cautionary
pair.
And if there's
So what
something
did I do?
out there
I hopped a
that
plane
can
and went to
help
London.
fix this problem,
And that's, I mean,
well, if
to
the
me it was a
solution's
no-brainer.
there, who's
My
the
health
dummy
is on the
for
line.
not taking advantage
This is
of
a
the
one-way
solution?
street. If
So
you
I
practice
hopped a
dentistry
plane,
long
I went
enough,
to London,
you saw what your
and
dental
Bryant Dental
instructors
could not have been
looked
more
like. They all
fantastic.
looked
They
like
came and met
Quasimodo
me.
the Hunchback.
I got measured.
Every last one of them.
And a
Hunched
short few
over
weeks
like
later,
this,
I got my
complaining
first set
about
of
their
loupes.
back
Now,
and
this is a
neck.
funny story. I
And
got
to
my
me,
loupes,
that's a
and I put
cautionary
them on for the
tale.
first time,
And if there's
and I
something
reached for my
out there
instrument, and I
that
was
can
reaching in the
help
wrong
fix this
direction, and it took me
problem,
about a day to get
well,
used
if
to
the
the hand-eye
solution's there,
coordination, and
who's
that's
the
actually
dummy
a common
for not
question that
taking
people ask.
advantage
They'll
of
say,
the
well, how do
solution?
you relearn
So
because
I hopped a
your
plane,
eyes are
I
looking
went to
this way,
London,
and your hands going
Bryant
that
Dental
way.
could
It
not have been more
happens so
fantastic.
fast.
They
You
came and
retrain
met me.
very quickly.
I got
Funny thing is,
measured,
to this day,
and
patients
a
still
short
ask me
few
where I'm
weeks
looking.
later,
They
I
feel
got
like
my
I'm looking
first
out
set
the
of loupes.
window,
Now,
and
this is
then
a
I'm
funny
working
story. I
down
got my
like
loupes,
this.
and I put them on for the first time, and I reached for my instrument, and I was reaching in the wrong direction, and it took me about a day to get used to the hand-eye coordination, and that's actually a common question that people ask. They'll say, well, how do you relearn because your eyes are looking this way, and your hands going that way? It happens so fast. You retrain very quickly. I don't have that neck
Funny
pain.
thing is,
To this day, patients still ask me where I'm looking. They feel like I'm looking out the window, and then I'm working down like this.
For two reasons. Because Number one,
within a matter of
ergonomically,
weeks.
we haven't
and I
been
say
better
this
trained with what was available.
like a sense of relief and exhaustion.
What I mean by
say
that is
the pain started
calendar
going away.
year 2025.
And now I work
we have
every
solutions
day with
to the
my
most
chin up,
common problem,
and I don't have that
which is
neck
the
pain.
cause
The
of
profession
injury,
of dentistry
pain,
has miserably
early retirement,
failed us
and
as
disability
clinicians.
in clinical
for two
dentistry,
reasons.
which is this
Because
problem
number
right here.
one,
It should be
ergonomically,
standard
we haven't
operating
been better
procedure
trained with
for
what was
every dental
available.
school.
And
to make sure that
what I
dental
mean by
students
that is
learn how to have good
calendar
posture
year
right out of the gate.
2025.
And that comes from
We have
starting with a pair of
solutions
these
to the most
and the very chair
common
that I'm sitting
problem,
on, having a
which is the
proper
cause
ergonomic
of
stool
injury,
to get the
pain,
hips and the pelvis
early
right,
retirement, and
so the whole body
disability
can be
in clinical
alignment.
dentistry,
That's the only
which
chance
is
that
this
we have
problem
as
right here.
clinicians to not be debilitated.
It should
So
be
every
standard
dental clinician
operating
at every
procedure
level,
for
whether
every
you're a
dental
school,
student
to make
a
sure
young
that dental
dentist,
students
or even
learn how to
senior
have
in your
good
career. It
posture
doesn't
right out of the
matter.
gate.
You owe it
and
to
that comes from
yourself
starting with a pair of
to
these.
give yourself the
and
gift
the very chair that I'm sitting on, having a
posture
proper ergonomic
and
stool
ergonomics
to get
in
the hips
pain-free
and the
dentistry.
pelvis right.
Dentistry is
so
the
the
most
whole body can be in
ergonomically
alignment.
That's the
Unfriendly
only
profession
chance that we
there
have
is.
as
We all know
clinicians
it.
to not be debilitated.
Bryant Dental
So every dental
has solved it.
clinician at every level, whether you're a dental student, a young dentist, or even senior